thoracic foam roller. We recommend building up to a black or blue foam roller. It's a hardcore center. It's not squishy and forgiving on the outside, namely because in our experience the other foam rollers will contort to your body over time. And what we're trying to do with the foam roller is establish movement. Many people will say that I have a foam roller and they roll on it, which is great. It simulates more of a massage, but when I introduce people to a foam roller, what I ask them to do is actually just lay on it, as I'm looking for an ischemic pressure release, which is those sore spots when you lay on a muscle and you say, ooh, that hurts so good, and you know that you need work there. And when we get those ischemic pressure spots, we are trying to release them through a hold or a duration of pressure on that muscle. And so when I have you do the foam roller, which I'm about to demonstrate, it's very important that you don't put yourself into pain. Common mistakes made with the foam roller: people try to use too large of a diameter before they're ready. So if you're a senior patient or you have a lot of pain and we don't know if this is going to flare you up, we will use a towel, and we'll take a bath towel or a beach towel and we'll roll it up into a tight cylinder, and then we'll twist it, and we may even tape the end so that you can have a smaller diameter and a more forgiving roll to begin these exercises with. And if you feel that it feels good and it's no problem or challenge, you'll wrap a second towel around that one, doing the same thing, increasing the diameter, until you can get up to a foam roll itself. Some people will use PVC pipes, etc. But this is very important for anyone who comes in with any back pain, spine, or postural. We must increase your range of motion and your ability to move before we can change the location of things. A couple things: we want you to breathe and relax, and I'm going to demonstrate this, and hopefully you can hear me as I talk through it. Another important detail of the foam roller: notice when I lay back, I'm always going to take care of myself. I'm not going to hurt myself, and if I feel any type of pain or nerve pain, I want you to stop, cease, desist. Don't hurt yourself. You'll just see us on the next visit and tell us what you experienced, and we'll either make changes or give you different exercises. So notice that right now it's not at the butt or my sacrum, meaning the foam roller is not right at my butt here where my butt reaches my back. It's a little bit up closer to where my ribs attach on my upper lumbar, lower thoracic. This is important because although we're trying to soften the muscles, we're trying to create a shearing force between each vertebra so that we can actually start to stretch and move the paraspinal muscles. And that's why rolling and massaging the muscle doesn't get the same effect as just laying on the roller. If you need to support your head with a pillow, please do so. And remember, my hips will come up as I feel they need to. Do not keep your hips on the floor. I've seen many people try to break their backs, and just relax and take care of yourself. Okay, harm none first, and then treat yourself second. So I'm going to lay back, and I'm just going to roll over, and I'm going to relax, bring my feet in more comfortable, and let the foam roller arc my back and spine. I'm going to take 2 to 3 deep breaths and feel the stretch. Then I'm going to roll down one vertebra. Repeat. Roll. Now you would have done this for 5 or 6 repetitions. I don't have time to do it with you. I do this all day. However, once you reach the shoulder blades, the function of the foam roller is done. Remember, your spine will be bending anterior and posterior at this point. Your shoulder blades will be in the way. You can do it if it feels good. And if your neck hurts and you have a previous neck injury or a compromise, put pillows under your head. Support yourself. I can't reiterate that enough. You are not to hurt yourself. If it hurts, in this case, pain is not a gain. Okay, pain is going backwards. Okay, so once I get to the top, I'm going to repeat that going all the way back down. Each vertebra, 3 breaths, all the way. Now, one modification after you've done that for a week is to start to add a second dimension, meaning rotation, into the vertebra. So typically for me now, people that don't have pain as they do the foam roller, they're going to roll up in the neutral position, just breathing, and when they reach the shoulder blades, on the way down after they've already been warmed up, they're going to introduce a slight rotation. Meaning, I'm going to let one knee fall to the side and I'll take a breath. 3 breaths, the other leg falls. Then I'll roll down and repeat. That'll add more rotation to the spine and stretch the paraspinals even further, but you have to be careful that you are on the rib attachments, and if you feel pain, stop. You are accountable to take care of yourself, and this puts a great deal of pressure, depending upon your size and your overall health and age, on the facet attachment. So this is just a review for people who have been told to do this exercise, but if you have not been told to do it, do not do that. Okay, you can cause injury, and that's on you. So do not do it unless you've been instructed, but there's a quick review.